Good evening, everyone, and welcome to today's wonderful session. I'm very sorry, it really got delayed, a tough day today. So, got stuck up in the hospital, unable to come, but before going to sleep, let us do the at least 50 questions discussion of the today's full-scale grand test. I hope you all have taken the test, downloading the Incus learning app and solved the paper. And what is our promise? In the 100 questions that I give you as a daily test, which are full-scale questions, most probable questions, if you are able to score 70%, inevitably you will get a top rank. That's my guarantee to all of you, right? So let's make the great beginning, doctor. Now, the middle meningeal artery, it typically passes through the foramen spinosum, is what you need to remember. So, middle meningeal artery is the third branch of the first part of the maxillary artery, is what you need to remember. What is the karyotype of oogonium? Once more, I want to tell you, doctor, spermatogenesis, oogenesis. Sorry. Is a hot steaming topic in the NEET PG examiner question bank. So to be 100% sure if you have answered this simple question wrong. Good to see Abharanam, Steffi, and many more who are all online. Great, doctor. So if you look at the oogonium typically has 2N. It undergoes mitosis, produces primary oocyte which arrests at prophase 1 before the birth. It is also diploid. Then the meiosis continues, polar body is extruded, secondary oocyte which arrests in the metaphase 2 after puberty. Then when ovulation occurs, sperm enters, then the meiosis is completed and that leads to a fertilized egg, which is once more 2N, is what you have to basically remember. Now, so similarly, if you take spermatocytes, spermatogonia are 2N, mitosis plus growth will cause primary spermatocyte, which is also diploid. Then meiosis 1 occur, producing secondary spermatocyte. Then it undergoes meiosis 2, leading to spermatid, which undergoes differentiation to form the sperm. So it is the secondary spermatocyte phase during which a haploid cell, a haploid sperm is being produced, is what you need to remember. Now, what is the branch of the first part of the axillary artery? It is a superior thoracic artery. So you should know that the pectoralis minor muscle divides the axillary artery into the first part, which is medial to pectoralis minor, second part, which lies underneath the pectoralis minor, posterior to it, third part, which is lateral to the pectoralis minor. So if this is the pectoralis minor, then medial, lateral, underneath, under the pectoralis minor muscle. So one of the favorite Bhatti Marnevala item asked in the entrance is, what are the branches of the axillary artery? First part Superior thoracic artery. She tastes like a sweet apple pie is what you need to remember. Second part, 2 branches. Tastes like thoracoacromial and lateral thoracic artery. Third part, sweet apple pie, 3 branches. Subscapular artery, anterohumeral circumflex artery and posterior humeral circumflex artery, and it continues. Axillary artery will continue as the brachial artery is what you need to remember. Juxtaglomerular apparatus, what does it include? The mesangial cells, macula, densa, and juxtaglomerular cells. So you have to be very, very sure about the structure of this juxtaglomerular apparatus. Good to see Anil, Joshi, and many more who are all online. So I hope you all have downloaded the Incus app and subscribed to the 40 full-scale grand tests daily up to April 15th, where there are 4,000 MCQs, 100 MCQs each grand test. Morning you take the test and evening I will discuss the paper. That is the deal. So this is the macula densa, efferent arteriole, and these are called juxtaglomerular cells. This is the afferent arteriole, and these are the mesangial cells. So now you know the structure of juxtaglomerular apparatus, which will be asked by the examiner. Now, doctor, I already told you. What did I tell? एक question आएगा, एक question आएगा, एक question आएगा. Type of epithelium. NEET PG exam is not for 200. It is only for 199. One question आएगा, जरूर आएगा on one of the type of epithelium. There will be 5 or 6 questions in anatomy, doctor, out of 200 questions. One question epithelium. Be very sure, right? So it is the stratified squamous epithelium which is lining the lingual surface of the epiglottis is what you need to remember. So if you look at the epiglottis structure, the oral side, and this is the respiratory side, the thick stratified squamous epithelium, which is there on the oral side of epiglottis, whereas pseudo stratified columnar epithelium, which is there on the respiratory side. That is the reason epiglottis you should remember. Now, what is the second messenger of the G protein coupled receptors? Cyclic AMP. So all the secondary messengers you have to know, doctor. So there are 2 pathways. One is CAM, cyclic AMP pathway, other is phosphatidyl inositol pathway. Now, intracellular receptor is which one? Calcitriol is the intracellular receptor. So the hormones that bind with the intracellular receptors, the androgens, estrogens, progestin, retinoic acid, glucocorticoids, metallocorticoids, thyroid hormone, and calcitriol. Group 2 are those hormones which bind with the cell surface, where cyclic AMP is the secondary messenger. Alpha 2 adrenergic catecholamines, beta 2 adrenergic catecholamines, calcitonin, ACTH, FSH, LH, PTH, TSS, somatostatin, and glucagon is what you need to remember. And very few have cyclic GMP as the second messenger. Atrial natriuretic polypeptide. You all know, no? In SIADH, there is an increase of atrial natriuretic polypeptide because of the plasma volume expansion caused by the inappropriate antidiuresis and retention of water. So atrial natriuretic peptide, nitric oxide, cyclic GMP is secondary messenger. Calcium or the phosphatidyl inositides are the secondary messenger for ADH, platelet-derived growth factor, angiotensin to TRH, GnRH. Whether you like it, whether you don't like it, you have to mug it. There is no other option. Definitely aane wala batti item. So doctor, you don't read anything also. Last 60 days, every year, last 60 days, I pick up 6,000 most probable questions and conduct them as 60 daily grand tests. You tell your juniors also. You don't read anything also across the year. Last 60 days, a 6,000 most probable MCQs का टेस्ट ले लो, डिस्कशन सुनो, टेस्ट ले लो, डिस्कशन सुनो, खत्म, automatically seat आएगा, right? So that's a plan. Similarly, kinase cascade for insulin, growth hormone, etc. So I leave the literature for you, doctor. Now, calcium binds to which part of the skeletal muscle? Once more, what is the high yield topic which you need to be very sure about? Skeletal muscle, smooth muscle, contraction, contraction. Definitely आएगा एक क्वेश्चन. नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. बराबर? So, see, if you attend directly like this, you won't pick up. You take it like a question paper on the Incus app. Discover how much score out of 100 are you getting. Are you crossing 70 or not? That should be your only goal, doctor, every day. Then identify 10-15 topics where you have gone wrong. Just to go back to the 2000 HD video library on the Incus app and do the revision of those topics. Must seat आएगा, दौड़ते हुए आएगा seat. Tension नहीं है. You have a lot of time now. Calcium bind to troponin T. So troponin C binds with calcium, C for calcium, to produce a conformational change in the TN1, troponin I. Troponin T binds to the tropomyosin, interlocking them to form troponin-tropomyosin complex. Troponin I binds actin in the thin myofilaments to hold the troponin-tropomyosin complex in place. That's what you need to remember about troponin C, troponin T, troponin I. Then narrow muscle contraction coupling, everything you should know. Nephron. Kidney can't generate a new nephron. It would have been great if it would have done like that, just like the liver. No, but kidney is not a liver. Cortical nephrons are small in size. Vasa recta is a feature of juxtamedullary nephrons. And juxtamedullary nephrons are 15% of all the nephrons. Once more, shoot short topic क्या है बोलो कल के नीट पीजी में? Nephron physiology, paper out. NEET PG में at least 1 out of 6 to 7 questions that come from physiology. Out of 200 questions, 6 to 7 come from physiology, doctor. Out of that 6 to 7, 1 question nephron physiology से नहीं आए तो मेरा नाम मुरली भरद्वाज नहीं. Once more, you need to go back to the Incus learning app, go to the 2000 HD videos, in that, go to the physiology, in that, go to the nephron and please do the revision. And tell that next mock test me, if a nephron based question comes, you're not going to do wrong. Chemical respiration, regulation of respiration. The peripheral chemical chemoreceptors are the only receptors that respond to the changes in the oxygen partial pressure, is what you need to remember. Now, what is a typical example of an allosteric enzyme? Aspartate transcarbamylase in the urea cycle is the allosteric enzyme. So, ornithine decarboxylase is one example which is inhibited by DFMO. Allopurinol is oxidized by xanthine oxidase to alloxanthine, which is a strong inhibitor of xanthine oxidase. भैया allosteric enzyme का मतलब क्या है? You know very well that every enzyme will have a substrate binding area. So allosteric enzyme has one catalytic site where the substrate binds and a separate allosteric site where modifier binds. Now, what are the three characteristic features of the allosteric inhibition is my question to all of you. Thus, inhibitor is not a lookalike of substrate. ये नॉर्थ पोल के जैसे दिखे तो वो साउथ पोल के जैसे दिख सकता, ये सुंदर के जैसे है तो वो बंदर हो सकता. So inhibitor and substrate are not lookalike in allosteric inhibition. It is partially reversible. If you increase the substrate concentration, you can reverse it. And most allosteric enzymes are made up of subunits. Subunits is what you need to remember. For the glutamate dehydrogenase, what is the allosteric inhibitor? Activator. ADP. For the glutamate dehydrogenase. So, the ATP, GTP, palmitoyl CoA, they are all the allosteric inhibitors. Whereas the zinc is also allosteric inhibitor. Whereas activators are ADP, GDP, and leucine. For the glutamate dehydrogenase is what you need to remember. Good to see Bhargav Rathi and many more who are all online. Midnight Masala with Dr. Murali Bharadwaz. Today I am very late from the hospital. I was feeling very guilty. 6 o'clock class 10 बजे हो गया, 10 का 10:30, 10:30 का 11, 11 का 11:30. Oh my God. I thought you will all be angry with me. Thank you to be not angry and to understand me. And remember, Dr. Murali Bharadwaz is your classmate, roommate, benchmate, tablemate, and I promise to hold your hand and take you to become the winner. Remember, you are the most brilliant guys. That's how you got into medical college. The most important factor to become a NEET PG topper, every day I keep reminding you is, you should believe yourself. Don't worry about what you wasted yesterday. It won't come back. What doesn't come back, there's no point in regretting in this short life, right? Right? The boy whom you wanted to marry, married somebody. So what? The girl whom you want to marry, gone away to America. So what? No regrets. Life regret-free is most important. Sometimes we miss a diagnosis. We miss a quick decision. Even before we do a CPR and do the defibrillation, patient is gone. Then what is the meaning? We know that defibrillation should be done at that moment, but we could not do. That doesn't stop us from living a great dream of being a great cardiologist, right? So that's the reason, doctor, I want to tell you, forget about yesterday. आज क्या कर सकते हो? आपके हाथ में क्या है? Next 30 days में क्या कर सकते हो? That is most important. If some fool happens to bother you by saying, hey, I'm a gold medalist, I used to read 12 hours, I used to read 14 hours. Don't worry. Probably if somebody sits in reading room for this kind of outside heat for 14 hours, he may become a topper, but he will end up to become the hyalinized scrotal testis for the kind of outside summer temperature. Thanks, you're not that. So that's the reason, don't worry what others are. So every day, small targets, 10 topics, let me pick up. Sure shot आने वाला topics. Let me do 20 points on each of these 10 topics first. Focal segmental glomerulosclerosis. For example, you have done the question wrong. You have to quickly go and accumulate what are the 20 points I'm going to remember. You have done a question wrong in our daily mock test on acid-base disturbances. Okay, respiratory acidosis, high CO2. Metabolic acidosis, low bicarbonate. Then, how do I calculate anion gap? What is normal anion gap acidosis and what are the high anion gap acidosis? Totally, there won't be more than 30 to 40 points in a topic doctrine. Usko pakadna. You should know what the examiner is going to ask. So you have 2000 HD videos on the Incus learning app. Every topic, 20-minute short videos. Revision is being done. So your job is simple. Go to the daily test, take the test, whatever be your level. Identify 20-30 topics where you are going wrong. Go back to the HD videos and do the revision. And evening, join for a discussion with Dr. Murali Bharadwaz. That's all you need to do in this last 40 days. There is nothing like last 40 days, right? That makes us feel sad. So, doctor, coming back to the business, which is not a nitrogenous waste product. So, you should remember that uric acid, urea, creatinine, they're all nitrogenous waste products. Once more, doctor. Glycolysis, gluconeogenesis, citric acid cycle, all these things. Beta oxidation of fatty acids. What is the ATP yield? Is the favorite topic of the examiner. So, you should remember that glycolysis yields 2 phosphate bonds of ATP. Gluconeogenesis expands 6 phosphate bonds of the ATP and the GTP. Is what you have to emphatically remember. Most often, monosaccharide separation, it is done using chromatography, is what you should remember. Endemic typhus is Rickettsia typhi. Now, dengue fever is caused by arbovirus. L form of bacteria. Typically, whenever you use the penicillin that produce the cell wall deficient organisms which are called L forms, they can infect the immunosuppressed who have undergone bone marrow transplant. L means Lister Institute of London is what you need to remember. Now, doctor, this is a sure short topic. If you have done this question wrong, now only you need to go and revise. HIV microbiology. It will be maximum 3 pages in the book, doctor, on HIV microbiology. But today only, if you have done this question wrong, quickly go and correct it. Wash karo usko, laundry mein dalo, a topic ko. GP120. So typically the HIV has a GP120 and there is a CD4 receptor to which this GP120 will be binding, is what you need to remember. Ebola virus transmission, it is close personal contact. C3b, it opsonizes the bacteria. Alpha glucosidase inhibitor, which one? I already told you. Definitely one question will come from insulin, oral hypoglycemic agents. So we have discussed almost 110 videos of 20-minute duration, end-to-end of pharmacology, and made available in the Incus app under 2000 HD video program. Please go and kindly revise if you have done this question wrong. If you have done it correct, you don't need to think about it or worry about it. Miclitol, acaribose, miclitol, oglibose, they're all alpha glucosidase inhibitors, is what you need to remember. INR is monitored with warfarin therapy. What are mood stabilizers? So you should know lithium, valproate, lamotrigine, carbamazepine, oxycarbazepine, they're all considered to be the mood stabilizers. Some of the atypical antipsychotics like risperidone, olanzapine, quetiapine, ziprasidone, they also have a mood stabilizing effect. And clonazepam, it has both anti-anxiety being a benzodiazepine and also anti-convulsant. Which drug act on motilin receptor, doctor? Erythromycin. Genetic polymorphism is a phenomenon that you see with acetylation. Slow acetylators, fast acetylators. This is a beautiful question. Once more I am telling you, pharmacokinetics, first order reaction, second order reactions, sorry, no second order, zero order reactions. Barabar? Then volume of distribution, T half, bioavailability, all these things you have to be 100% sure. Loading dose, maintenance dose, all these formulas, tips, very, na doctor. So, typically here, loading dose formula is what? Volume of distribution into desired plasma concentration. So this person weighs 70 kg, so 60% of 70 kg is 42 liters. And what is the desired concentration? 5 milligram per liter. So 42 liters into 5 milligram per liter ho gaya. 210 milligrams is considered to be the loading dose. Oxidative burst basically is mediated by what? Give me 1 minute time, doctor. 1 minute. So oxidative burst and phagocytosis, they are mediated by the GCSF, granulocyte colony stimulating factor, even interleukin 8 also. Ulcerative colitis involves only mucosa, whereas Crohn's disease is transmural. That's the point you need to appreciate. Now this is another sure short MCQ. CD, एक CD के बिना question paper नहीं है. So doctor, CD19 is considered to be the B lymphocyte marker. CD16 is a good NK marker. CD19 for B cell. CD3 is called pan T cell marker. And any defect in CD19, it leads to common variable immunodeficiency of type 3 is what you need to remember. So once more, stem cells, CD34, CD31 minus, and CD117. Very good. Good to see Sindhuja Ravichandran. Beautiful name. So, doctor, thank you for being midnight show with Dr. Murali Bharadwaz for the NEET PG preparation. Thanks for joining the session. And also inform all your friends to join. All leukocyte groups, CD45. Similarly, monocyte, T lymphocyte, helper T cells, cytotoxic T cell. I leave this forest, ruthless forest of examiner. One question definitely I have. Large abnormal mitochondria. You see it in thyroid oncocytoma. Now, once more, doctor. This apoptosis in the pathology, out of 6 MCQs which are going to come, 6 MCQs which are going to come, sure shot आने वाला topic है doctor, apoptosis. Apoptosis. If you have done this question wrong, go back to the Incus 2000 HD video library in pathology on the Incus app. Please do the revision. Definitely आएगा. आपका personally एक 25-30 points आपके मुट्ठी में रहना apoptosis बोल के मैं scratch करे तो you should start vomiting it out. That should be the last moment preparedness for the battle. So it is the cytochrome C. EPOF1 is activated by the release of cytochrome C. Once cytochrome C is released, it binds with the EPOF1 and it facilitates the apoptosome formation. Is what you need to remember. IV drug abuser Manipuri landed with nephrotic syndrome. It is not responding to steroids. So it is the focal segmental glomerulosclerosis, FSGS. Always remember, whenever a patient has a nephrotic syndrome, especially elderly person, think of membranous nephropathy. Whenever membranous nephropathy is discovered in an adult, always search for an internal malignancy, and that would be lymphoma commonly. Rule number 2 about nephrotic syndrome. Normally, nephrotic syndrome lead to 2 milligram, 1 milligram, 1 gram, 2 gram proteinuria. But massive proteinuria is there, 5 grams, 6 grams, 7 grams. Then always think that this nephrotic syndrome could possibly be because of the underlying FSGS is what you need to basically remember. So you should remember membranous glomerulonephritis is most common in adults. Malignancy, underlying malignancy के लिए search करना membranous glomerulonephritis है तो, and it makes clots because of the hypercoagulability. Now, if you look at the most common cause of the nephrotic syndrome in children, it is the minimal change disease. Adults, it is FSGS. Old age, it is membranous glomerulonephritis. Overall, it is FSGS. This is the important point you should not forget. So broadly, you have a nephritic syndrome, nephrotic syndrome. Nephritic syndrome होता है PSGN में, post-acute glomerulonephritis. Rapidly progressive glomerulonephritis, it is also called crescentic glomerulonephritis. What are crescents? Bowman's capsule is there, no doctor. It has one visceral and one parietal epithelium. Visceral epithelium, you have podocytes. Parietal epithelial proliferation will lead to the formation of the crescents. So, what is a pathologist's definition of a crescentic glomerulonephritis? What is the counterpart of that of a clinician's definition? Clinicians call it as rapidly progressive glomerulonephritis is what you need to remember. Similarly, IgA nephropathy of Berger, Alport syndrome, they're all nephritic syndrome. Whereas FSGS, membranous nephropathy, minimal change disease, amyloidosis, diabetic glomerulonephropathy, they're all nephrotic syndrome. Both nephrotic will be seen with diffuse proliferative glomerulonephritis and membranoproliferative glomerulonephritis is what I want to underscore to all of you. Now, if you look at FSGS, primary FSGS means idiopathic. Secondary means there is some underlying cause, commonly sickle cell disease, HIV, renal hyperfiltration because of the unilateral renal agenesis. Any person taking IV drugs like heroin abuse or any genetic form like FSGS 1 to 6, they are the underlying cause is what you need to remember. Similarly, morbid obesity or any chronic kidney disease due to a congenital malformation, it is considered to be the risk factor for FSGS is what you should understand. Once more, glomerulonephritis, doctor, sure short topic tomorrow in the NEET PG exam. No doubt on that. Just give me 1 minute. Now, doctor, welcome back. Aseptic autolysis seen in case of maceration. So mummification, adipocene, putrefaction, maceration, all this post-mortem changes, you have to be 100% sure. Now, doctor, in a dead-born fetus, what do you see? We see maceration, rigor mortis, mummification, not adipocene. Most common fingerprint pattern is loops. Loops is what you need to remember. Forensic medicine तो very standard questions होता है. 5 out of 5 you can hit and come out. Forensic, उत्तर simple. One question definitely will come from one of the IPC code. All IPC codes you have to be sure. Bluish discoloration of the neck of the tooth is because of nicotine. The diagnosis of the brain death, a flat EEG, no spontaneous breathing, dilated fixed pupil. They're all the part of the international definition before you call brain death. ESI, extended sickness benefit, is payable for a duration of 3 years. So 91 days of sickness benefit is in insured persons. There's an extended benefit for 34 diseases. It is for a period of 3 years from the date of commencement of the spell of certified incapacity. 3 years. Now, osteitis can be associated with BCP. A hygiene hypothesis was proposed for asthma. A lack of early childhood exposure to infections and symbiotic microorganisms will increase the susceptibility to allergic illnesses. बचपन में infection नहीं मिले तो बड़े होकर एलर्जी बढ़ जाएगा. That is very important. As doctors, we will try to over-medicate our children. The common cold starts. The moment he sneezes, you will try to push as many antibiotics as possible. That's common with all the doctors, the way they play with their child's immune system. The late expanding phase of the demographic cycle, the death rate declines more than the birth rate. Health planning and survey committee is called Mudaliar committee. A health worker visiting the houses fortnightly and asking about Amma, Bukar hai kya, fever hai kya. That is called surveillance. The richest source of the protein, soya bean, which is called poor man's meat. Poor man's meat, it is called as soya bean. With regard to the disability, Wing's comprehensive handicap behavior and skill schedule is the one which is used to assess the disability. Disablement benefit. The rate of temporary disablement is about 70%. In case of total permanent disablement, insured person is given a life pension. If the mean is 230, standard error is 10, it will be 2 into 10, 20. 230 minus 20, 230 plus 20 will be the two sides of 95%. So 230 plus 20, 250, 230 minus 20 is 210. 210 to 220 is two standard deviations. Ogive curve is also called percentile graph. An ogive is a line graph where the bases are the class boundaries and the heights are the confidence intervals. That is called ogive. Total fertility rate, net reproduction rate, gross fertility rate, couple protection rate, all these rates, मालूम होना है doctor. Total fertility rate is the summation of all age-specific fertility rates. The average number of children likely to be born by a woman in her entire childbearing age is called as total fertility rate. It takes into account the mortality and fertility pattern among the women of that period of time. Metabolic acidosis, where do you see that? Hyperaldosteronism leads to metabolic alkalosis. Similarly, decreased aldosterone should lead to metabolic acidosis. Non-ion gap metabolic acidosis, where do you see? In renal tubular acidosis. High anion gap, lactic acidosis, ketoacidosis, alcohol use, methanol, ethylene glycol, propylene glycol, lactic acid, uremia, fenformin, aspirin, iron, isoniazid. Abba, you have to remember all those things. What is muscle power? Grade 3. Clinical question, doctor. Full range of motion with gravity is grade 3. So no contraction is 0, slight contraction, no movement is 1, full range motion without gravity is 2, with gravity is 3, some resistance 4, full resistance 5. Good to see Yugender, Bobby and many more who are all online. Eosinophilic effusion, pulmonary embolism, asbestos, pneumothorax, anything of them can cause. The most common location where you find the hypertensive bleed, doctor, putamen. Now let us take the various immunosuppressives. Sirolimus, tacrolimus. What do? They decrease the T cell growth factor pathway, is what you need to remember. Azathioprine decreases mitosis. Glucocorticoid decrease the IL-1 and IL-6 production. Mycophenolate decrease the DNA synthesis. Cyclosporine decrease the T cell proliferation. That is the story of the various immunosuppressives and their mechanism of action. You have to be very sure. Intrarenal vasoconstriction. Radiocontrast agent, cyclosporine, FK506. They all lead to nephrotoxicity by causing intrarenal vasoconstriction. But acyclovir directly goes and damages the tubular epithelium. Normally, chronic renal failure leads to shrinkage of the kidney size. But CRF with a normal size of the kidney, where do you see? ADPKD, diabetes, amyloidosis, in spite of CRF, there will be normal sized kidney, is what you should remember. Now, if you look at the urine analysis, transparent hyaline cast, generally they are very benign and common. Lymphocytes, NSAID-induced interstitial nephritis, you find lymphocytes. Transparent cast, hyaline cast in prerenal azotemia, whenever you are dehydrated. Muddy brown cast in acute tubular necrosis. Broad cast in CRF, WBC cast in interstitial nephritis. And where do you find eosinophiluria? NSAID-induced ATN. That's what you need to remember. Hypotension during dialysis, how can you prevent it? So sequential ultrafiltration, cool dialysis, ultrafiltration, modeling, they are all the various techniques. And vasopressor like midodrine is also used to treat the dialysis-induced hypotension. Combined estrogen-progesterone therapy in the postmenopausal women, what will it lead to? It increases the risk of hormone replacement,